Hello, everyone, and welcome to the Albert Schweitzer Fellowship Spring Fireside Chat, Upstream Leadership for Enduring Community Impact, in partnership with HealthBegins. I'm Rachel Gold, Executive Director of the Albert Schweitzer Fellowship, or ASF. Since 1991, ASF has shaped the lives and careers of thousands of medical and graduate students across the U.S., challenging them to make their lives their argument, to build careers rooted in service, in partnership, and a commitment to improving the health of their communities. Today, we do that work in partnership with 53 academic institutions and hundreds of community-based organizations, clinics, and schools across our 10 chapters, from California to New Hampshire. Just last month, 242 fellows concluded their year. These fellows represent an extraordinary range of disciplines, from medicine, nursing, public health, and social work, to law, education, music, and beyond. They spent the past year designing and implementing community projects that address unmet health needs and strengthen communities. 70% of those projects will be sustained. These graduating fellows join a growing network of thousands of ASF alumni, what we call Fellows for Life, who understand to their core that moving the needle on health requires looking upstream to the social, political, and environmental drivers of health, and takes authentic partnership and deep community collaboration. But ASF's role extends beyond the fellowship year. We're also a convener of ideas, relationships, and action, bringing together leaders across sectors who are committed to creating healthier communities and a more equitable future. Tonight, we are so honored to gather three distinguished Fellows for Life for a conversation that celebrates the promise of our newest generation of fellows, that explores what enduring community impact requires of leaders today, and that challenges all of us to think more deeply about the role we want to play in creating lasting change. I'm pleased to welcome National ASF Board Member Dr. Pritesh Gandhi as moderator for this evening's conversation. Dr. Gandhi is a senior leader at CommonSpirit Health. He previously led community health efforts at Walmart Health and served as Chief Medical Officer for the Department of Homeland Security. Dr. Gandhi has been an invaluable partner as ASF has reflected on the strength of its past and charted an ambitious path forward. Dr. Gandhi, over to you.
Rachel, thank you for the intro. It's great to be here with you all. I'm thrilled really to be in conversation, of course, with Dr. Manchanda and Jess Lahey, who you'll hear from more in just a bit. But first and foremost, really thrilled to be here with new fellows for life, those that are new to the organization, that may be new to the fellowship, those that just finished their fellowship year, supporters of the program. It's really wonderful to be in a room of individuals that are earnest in their desire uh, to improve the lives of those in their communities. The purpose really for this Fellows for Life fireside chat is first and foremost to obviously celebrate our 242 newest alums. These are students from really across fields, including medicine and music and nursing and law, who spent the past year alongside your studies, launching and leading community health projects all around the country, and really all around the country. I've had a chance to go through and look at some of the projects from fellows. It's really incredible. In Alabama, Tawana expanded cervical cancer education and screening for women experiencing homelessness, helping to remove barriers to life-saving preventative care. And in San Francisco, Vicky, you provided diabetes education, support for Ukrainian, Russian, and other refugees, helping newcomers manage chronic disease and navigate our healthcare system with confidence. In Tulsa, Lucretia improved outcomes for justice-involved youth and their families, creating stronger support systems for young people navigating the juvenile justice system and the adults who care for them. This is just a tiny slice of the incredible array of projects, initiatives, partnerships with community-based organizations, with communities that we seek to serve, with academic organizations all around the country. So I think the individuals that are on this room truly represent some of the most community-minded individuals in our nation. So again, in addition to celebrating our newest Fellows for Life, we really hope to inspire the broader Schweitzer Fellowship community, supporters, and our friends to consider how important leadership development is as an upstream strategy to advancing health equity and enduring community impact. And we'll talk more about that as we get into the conversation later today. Lastly, during the conversation, we will introduce new pathways for connection and collaboration and continued leadership. And so we're thrilled to have folks here tonight from, I believe, now 17 states that are dialing in. And of course, we'll be recording this conversation as well. So again, welcome to all. So let's first start with some introductions. I could spend a long time going through the biographies of Dr. Manchanda and Jess Lahey. I will let them both introduce themselves. I think we're in for a treat tonight. Rishi, first off to you for an introduction. While you're getting off mute, let me turn to Jess. Jess, over to you.
Um, so nice to see everyone tonight. Well, not see. This is the weirdest thing. I do a lot of virtual presentations, and I always say it's so nice to see everyone. But every single time I get to interact with new Schweitzer fellows, or even when I'm helping with applications for the next possible incoming year of Schweitzer fellows, I always come away feeling really renewed. And so even not being able to see your faces on here and just hearing about the projects, I've already jotted down like, oh, wait, Lucretia and Tulsa, I need to talk to her because justice involved youth. That's one of the things that I'm really interested in. So I'm always happy to be a part of this program. So I was a fellow. I was the first North Carolina law fellow for life. My husband, Tim Lahey, was a year ahead of me in the fellowship. He did a medical fellowship. And the two of us have sort of felt like this Albert Schweitzer Fellowship is something that we keep showing up because we love this program so much, and part of that has to do with the fact that when we show up, we feel like we get redirected in our own careers. And my career has really strayed from where I thought it was going to go. So for those of you who are like, I'm absolutely positive, I know exactly what I'm going to do, and you get to a place where you find you're not using the things that you thought you were going to use this fellowship for, don't worry. You're going to find plenty of opportunities. I thought I was going to be in juvenile justice, and I've ended up continuing to be an educator from middle school to high school, and now sort of on an international stage, traveling around, teaching parents around topics like competence and autonomy for kids and how real learning happens and substance use prevention. So the things I thought I was going to do are very different from what I'm actually doing. And yet at the same time, I get to use what I learned at the Albert Schweitzer Fellowship over and over and over again. And I'm so grateful for the opportunity to still be here, after, oh my gosh, 97. It's a long time ago that I was an Albert Schweitzer Fellow. So thank you so much for having me here tonight.
Jess, thanks for being here. I was looking through the participant list. I actually see Lucretia is actually on this call.
Yay!
So if your ears are burning, there you go. And we'll be contacting you later. Rishi.
Absolutely.
Pritesh, thank you, and thanks to Jess and to Rachel. Of course, Rishi Manchanda. I live on the West Coast in the Greater Los Angeles area, and was a fellow for life I'm a fellow for life, and was a fellow in 2000. I think finished in 2000. It's been a minute. While I was in medical school in Boston, and had the opportunity to work with an organization called Soldados de Salud, which was affiliated with Partners in Health. And it was around that same time, I think the fellowship came in about a year after I had interned at the Institute for Health and Social Justice, which was a research institute affiliated with Partners in Health as well. And that's where I got to know folks like Paul Farmer and other incredible role models along the way. And yeah, many fond memories of the fellowship, not just because of the work it enabled, especially to ground myself out of medical school and the kind of professionalism that was a wonderful attribute there, also becomes sometimes a constraint. It can prevent you from understanding like how to situate one's work in a broader context, especially one grounded in community and social justice principles. And so I really valued the anchor that the fellowship provided for me at that point. And I carry that through my that kind of lesson of how to stay grounded, always be checking against the kind of context of our professional domains that sometimes keeps us not just in silos, but sometimes keeps us more and more removed from those who have the least. And so a lot of fond memories about the fellowship. I moved to California after finishing my medical and public health degrees at Tufts. As I was sharing with Pritesh and Rachel and Jess earlier, my wife, who was a Schweitzer fellow, she was in Vermont at medical school. She was a year behind me. She was born in Zambia and raised in Botswana of Indian origin. She just said, find someplace warm. And so I went west based on that ultimatum and came to Los Angeles, finished my residency in internal medicine and pediatrics. And as part of the National Health Service Corps, went to go work in a variety of clinics South Central Los Angeles and a network of community health centers there, where I started a social medicine program at the VA, building clinics for homeless veterans with incredible people, patients included. And then in the Central Valley of California, where I built clinics for agricultural workers, and now leading an organization called HealthBegins, which I'll talk about more in a second. But the through line through all of that absolutely that includes the fellowship was this understanding of what it means to move upstream and how to bring it to life. It's
Thank
good to
you.
be. Yeah.
Thanks, Rishi. Thank you for both the intros, both you and Jess. Let me actually play off of something you just mentioned, Rishi, in your intro, which was I wrote down notes here. It sort of removed you from the silos of what can happen with professional training, whether you're in law school or medical school or any kind of graduate school. And I remember for me, one of the one of the families that I worked with when I was a Schweitzer fellow, I was in medical school, my first or second year of medical school, and worked with an organization called Share Our Strength. We were out in South Boston, and while I was simultaneously taking classes in nutrition and metabolism, there was almost zero relationship to working with families in the community where we were doing nutrition education and specifically how to read a food label, how to purchase a whole chicken at the grocery store, and then cut and prepare that chicken for a family meal in a way that's both cost effective and nutritious. And we walked through a multi-month curriculum. I remember one of the families at the end saying that if we could just do our doctor visits here, and it was like a chef kitchen, if we could just do them here, we'd be able to accomplish so much more. I think I understood what it meant to be in fellowship with the community at that moment. And so I'll ask this of both of you all, which is, what does it actually mean to be in fellowship with people and with families and with communities, particularly those that are in need of the most resources? What did you all learn from your fellowship, and how do you think about what that means? Jess, maybe over to you first.
Sure. One of the interesting things that I learned during my fellowship, so my actual project was doing work with teen court in North Carolina, diverting kids out of the juvenile justice system and putting them in a position where they were adjudicating each other and deciding. Was a pivotal moment for me. Was I sort of pictured these kids who would serve on a jury and adjudicate their peers. I often got to sit in as a judge, which was super fun. I sort of thought these kids would want, I was picturing like the punishment side of things and that they would really be into this idea of like meting out punishment. But what they ended up doing was it was all about retributive justice. They were restorative justice, really. It was one of the first places I learned about that, even though I was in the middle of law school. It was one of the first places it really clicked for me. And I remember, for example, a kid who had really trashed a guy's business. And the jury, with the help, obviously, of the person whose property this kid had trashed, was required then to go work for this guy and undo the damage that he had done. And watching that restoration happen was really important to me at that moment, because at that time I thought I was going to be working in juvenile court. And balancing the needs of the community with the needs of, the justice system and the parents and all that sort of stuff. It was this incredible crystal clear moment of watching that healing happen in a community in real time. And that's something that not many people get to see. I think especially, in a world where we hear about quote unquote justice happening on court TV or whatever. But I was watching this relation, not only watching this harm be healed, but watching a relationship actually grow out of this thing that was quote punishment, or this idea of punishment. Anyway, so that to me has carried through in the sense that what I do now is I'm trying to help start conversations between educators and parents and kids and prime those conversations so that whether we're talking about substance use prevention or we're talking about what actually works for learning and helping the research trickle down, I'm priming conversations that will build relationships and help everyone, all of the stakeholders in that relationship. And that's, when people ask me what I do, I could say, well, I write books and I go out and I do a lot of speaking, but I really think my job is helping kids be seen, heard, known, loved for who they are, and also facilitating communication between people who sometimes talk at each other and not necessarily to each other. And that's an incredible privilege to me and something I definitely learned in the Schweitzer Fellowship.
Hmm. Rishi, you have thoughts on that?
Yeah, I really love that story, Jess. I'll share that to answer the question about fellowship. I'll share what has for me been the working definition of moving upstream for some time. For me, moving upstream means to reduce harms and to improve the conditions that put people in harm's way. It's very much derived from what Paul Farmer and others described as the kind of social medicine kind of definitions when they popularized that about 25 years ago. And the reason I share that is because in the context of what fellowship means, for me, with people, neighbors, communities, including people that we have the privilege of serving, I think part of it means being able to listen for and bear witness to, but then also be there when harm is manifest. And to start with that first question, it's like, is this person experiencing harm, or to ask people directly, like, what does harm look like? And that can mean the harm of health inequities, the statistical kind of differences that really experiences harm by real people. It could be the harms of unmet social needs, food, housing, the harms ultimately of poverty and of kind of marginalization and where it's poverty by design, right? And also, and this is the last point I'll mention, especially to kind of see if I can link this in to see if it resonates with folks. And that includes the harm, reducing the harm. Moving upstream means reducing also the harms of moral injury. And I mean this because this has been very much something that I saw both drew me towards this, both in the fellowship and the work thereafter. I think many folks in the different professions, including the health professions, can probably attest from early on that they've experienced some degree of a psychological, maybe even spiritual wound that occurs when you're working in a system that is not equipped to fulfill your oath, your values, your aspirations. And particularly so when that system or the forces that shape that system are intentionally or in some cases even aggressively at odds with those values. We've seen this in the past, 20 months, for example, right now. So moral injury, I think, is a really important element to kind of name as well in terms of the harms that we think about. And moving upstream, if it's not just about reducing harms, but addressing the conditions that put people in harm's way, I think fellowship then becomes an act of not just community and an act of accompaniment, an act of being able to bear witness to harms, but it's actually being in fellowship is about building power, right? It's about resistance. It's about reimagining not just what power structures look like, but more fundamentally what relationships mean. Like fellowship is about, for me, being in relation, right, with all these concepts, but with people first and foremost, and in ways where you're not just observing or simply not just providing charity, right, but instead reimagining what justice looks like through relationship.
Well, I
That's
mean, let's talk about this a bit more. I appreciate that both of you here spoke about what it means to build relationships. There is a lot written in both popular and academic literature around this in this era that we are arguably have more opportunities for connection, whether it is via, in person, virtually, email, social, pick your medium that we're at a height of loneliness and a height of social isolation. And so to be able to be in fellowship with someone means you have to actually build that relationship. And I find that that's difficult for folks these days, and for many of the individuals on this call who are likely earlier in their career, there's this perhaps even more preliminary questions, which is how do you help? Yes, be in fellowship, yes, build relationships, but how, right? And the question that I mean, it's really a conversation that I had last week with Dr. Lachlan Faro, and I don't think he's on the call here. And for folks that don't know him, we could spend an entire webinar talking about him. He's this really incredible clinician, senior fellow now at Harvard Medical School Center for Bioethics. He's president emeritus of the Albert Schweitzer Fellowship. But just last week, I was on a call with him, and he was recounting in writing later some of his prior advice. And he mentioned how his role model for helping actually is Dr. Mukherjee. And I know, Rishi, you just mentioned Partners in Health. She is now senior clinical academic advisor at Partners in Health, but he summarized her advice in terms of how to help really in a few points. He said, number one, show up. Number two, ask the person there, how can I help? Number three, then keep your mouth shut and wait for them to answer. You may need to ask this question a few times, but keep your mouth shut, importantly. Then four, help them in whatever way they ask. If you're a doctor and they say you need a toilet unclogged, then do that. Number five, then he recounted that what then develops is the right kind of relationship centered in the person needing and wanting help. And if the right kind of relationship is established, then really anything can grow out of that. And if you don't establish that relationship, nothing really will. That's how he recounted how to help. I'm curious how that manifests in the world that we're in today, based on what you all were saying.
Well, I'll go first simply because something very immediate comes to mind. I was just talking to my husband about this over the weekend. I went to a reunion. One of my students who's going through some stuff asked me to show up for this reunion, and she's having a hard time, so I showed up. And she did this thing that happened. Anyone who's ever been in teaching or who's ever worked with kids will recognize this situation. But she talked about this moment back when she was in middle school. She's now in her late 20s. That really, really meant a lot to her. That was really a pivotal moment for her, and it was so important and loomed so large for her. And I have almost no memory of this situation. It was something that to her was massive. And this happens to me all the time where I'll have a student or someone I spoke to at an event, or even someone who reads something that I wrote and say, this was super important to me. And I have to realize that the things that I'm trying to convey, the teaching that I'm trying to do, or my possibly even misguided attempts to create connection or misguided attempts to help, because that happens all the time too, right? I think I know what the problem is, and yet I haven't listened enough or I haven't established enough connection yet in order to know what the real problem is. Then if I'm only following based on what I think people need from me or what I think people need in their community, then I'm going to miss the point entirely. And, it happens all the time that something from my teachers say this all the time. I feel so bad for my early students, like I just knew, I didn't even know what I didn't know. But what I know now is that when I show up for people and ask them what they need and give them the space and time to think about it rather than just assuming that people are always going to know what they need from me or need from their community or need from another mentor right away. That you give that relationship room to breathe, and then hopefully you're able to come back in a way that's truly meaningful for them, even though it may be completely different from what you thought you were going to be able to offer going into the community in the first place. So that's especially in the situation I'm in now, which I find really challenging. I used to teach kids in the middle school. For example, I taught sixth, seventh, and eighth grade. So I taught these kids for 3 years in a row, developed very deep relationships with them now, them that I, hopefully can keep moving through now. But the way it works now is I often will go to a school and these people don't know me. I don't know them. I show up for a couple of hours and hopefully create enough connection for people to feel like I've done something worth their time. And really, what I've had to realize is that I have to be patient because of the stuff that, and I've learned to make myself available after the fact, because the stuff that I go into a school thinking they're going to need from me is sometimes diametrically opposed to what I find out later on is really what they need from me. And so that listening piece, how can I help and then shut up? that's it for me. That's, and how to do that in a way that's culturally responsive. That, as a white woman, I'm constantly having to figure out, like, okay, if I'm going into this Title I school, with lots of families, from lots of different backgrounds, I cannot center myself in that. That's not about me, and I need to figure out how to um, hear what they need and then hopefully offer what I can that will be of service to them. And that requires a lot of humility. And it took me a really long time to get there because I want to be the expert. I want to be the one that, we want to, especially as teachers, we want to be the sage on the stage and talk to the people in the room and know all the stuff. And that's just not how this works. It's just not how this works.
Yeah,
Appreciate
amen.
it. Yeah, go ahead.
Yeah, amen to that point. I think I'll maybe elevate or pull on a couple threads here that resonate with me from what Jess was sharing and what you were sharing from your conversation with Lachlan and Joya's kind of response here. I think first, uh, how to help, yes, has to start with just ask and listen, and then whatever the way is to help that people ask for, do that. And that has a profound, I'll pull up this thread that is really important, not just individually about how to kind of show up and act, but what it means for the work that we do, how we organize our institutions and deliver. So for example, one of the early lessons I've learned in my career, working in a community health center and then at the VA, where I was asked to kind of build clinics for homeless veterans, was how to apply this principle of, you know, show up, ask how to help, and then shut up. Turned out there are actually people before who have, this is where the hubris also has to be checked. It's like, wait, I'm not the first person to ask and listen and shut up. It's like, what have people said before when they ask the same question? It turns out there's actually a lot of answers that are out there that very rarely are listened to. At the VA, for example, 8 of the top 10 unmet needs that veterans were talking about consistently, especially veterans experiencing homelessness, were not clinical, they were not medical, they were social, they were legal, right? Needs. There were relational kind of needs, there were connections. And so what we then did was to do the next thing, which is what I think Joya was talking about as well, or what Lachlan was talking about as well, which is to then meet the immediate needs first. Well, how do you do that individually? Well, if somebody asks you to unclog a toilet, unclog the toilet. If someone asks you to kind of help, take something over to a neighbor's house, do that. When you're an institution and you're building a clinic for homeless veterans, don't build a medical clinic, build a program. If you have the wherewithal, like we built a program, not a clinic, we built a program that addressed the 8 of the top 10 needs. And we did it within the confines of a medical system, but we said the first people we have to hire is a lawyer and a social worker and other folks who can serve those needs. In other words, we built a clinic around that. And lo and behold, when we did that, when we addressed the immediate needs first that were prioritized in this case, in this instance of by the population that we were trying to help and serve and be in solidarity with, it turned out the other objectives totally got met more easily because it turns out when you actually show up and ask, listen, and then respond to the immediate needs to address the immediate harms that somebody prioritizes, whether as a friend, a family member, or a patient or a client, it turns out you build trust, right? And it also means that that person is more likely to kind of engage in the other activities that we did. So we had some of the best statistics in terms of clinical measures, not because we were a medical clinic, but because we were a legal clinic that happened to have a doctor attached. A lot of what it means to actually, I think, showing up how to help absolutely resonates. But what I really want to kind of elevate is that if you really follow this through, if you follow Joya's advice or Lachlan's advice or Jess's advice and walk this through, it has profound implications for what it means to actually how we deliver the services that we deliver. And what that means then for how we situate ourselves as professionals within that. And more often than not, it usually means taking our positions of privilege and power and thinking about how to flip the script, largely because the systems that we operate in are designed to perpetuate injustice, not necessarily um, to challenge it.
And Rishi, the systems that we're in are are not designed to actually solve they're not designed or constructed to actually address those problems. They're just not. And so it's a fair point.
That's where, can I say, Pritesh, to that
Yeah.
point, that's where, connecting to the first question you asked, and this is what
Yeah.
just, which this is where fellowship comes in, because fellowship is not, it's not friendship. Friendship comes as part of that.
Right.
But fellowship is actually a goal. I mean, think about the Lord of the Rings. They had a mission, dude. Right? They were not just friends, going on excursion. They had a mission. Fellowship means you're coming together. For me, moving a fellowship that comes together on this concept of moving upstream, or a life in service, as Schweitzer talked about, is actively working towards a common goal to dismantle the social and structural arrangements that put people in harm's way.
Mhm.
That's a hell of a mission that allows fellowship to come together. And with the fellowship, whether you're working in your profession, in your institutional setting, in your life, fellowship that allows you to kind of break bread with others who are now working towards a common purpose together, who are walking that journey to Mordor, right? Through all the, even if you're at one point in your career in a different institution or a different setting, a fellowship like the Fellows for Life program allows folks to stay connected to that, because to your point, not all systems are built or designed to be able to challenge the root causes of what's putting people in harm's way. They're there to sometimes just ameliorate the sequelae of those problems.
Well, let's talk a little bit more. And we could probably interrogate the word fellowship for quite some time. But let's talk a bit about the fellowship, the actual fellowship, and and what the implications are. I suspect have been many for both of you. We have a room full of individuals here, many of whom just finished their fellowship year. What would you say is one evergreen principle that you have carried with you from the fellowship? Into something that you've actualized into your day-to-day life now.
It's funny, while we were talking, I was struck by there was a program I used to work with that if I were to do a Schweitzer program, fellowship all over again, I know exactly what project I would do, which is to replicate a project I used to help with when we lived in New Hampshire. And this was an organization that helped sort of organize local gardeners and get the extra produce and then take it to the people in the community that really needed the produce. And I'm so glad that there were people there who had been involved in the program, before I stepped in to help, to warn me about certain things. Like you might want to take this in your car and you might want to take this because I thought, great, I'm delivering food to like 5 houses. This will take me an hour tops. But what I didn't realize, and what I came to learn from the people who knew a lot more than I did about this community and what the needs of the community were, is that I also needed to carry light bulbs in my car, and that I would be meeting farm animals. That I would help this woman who had geese, and one of her geese had bumblefoot, and I needed to help her with the bumblefoot. So instead of taking an hour to do what the aim of the program originally was, which was to deliver vegetables to people who had less access to fresh food, it was actually really to just show up and realize that, the person that I'm there to deliver vegetables to is actually coming to count on this program as a way to have someone check on her once a week to make sure that she's okay and that her lights work and that her geese are taken care of, I suppose. And that those people that went ahead of me, I wish when I became a new fellow that I had taken better advantage. And I'm sure my husband's watching this in another part of our house, because some of the key mistakes that he made in his fellowship year could have been he could have done an end run around some of those problems if he'd asked more people about, okay, what are the problems I could possibly potentially run into if I don't do this right, if I don't find the right stakeholders, if I don't find the right people in the community to sort of make sure I know what people need as opposed to what I think people need. And that we're here, like we're here, and you have access to us, and you have access to so many other fellows for life who have, why replicate problems you don't need to replicate? Why not just ask and find out how you could possibly go into your program, into your project, and have the best possible result, just not just for yourself, but for the community that you aim to serve. It's an amazing organization for just the resources available in terms of experience and brain power.
Yep, it's well said, and I've written down what you said, which is almost always the case, is to show up and do the thing, right? Just do the thing. Rishi, I'm curious if you have thoughts around what is something for you that was a core principle, a core evergreen principle, or a Dr. Schweitzer learning that you've brought with you through your career.
Well, I think there's a classic, my life is my argument kind of line that I think is always it always invites us to kind of challenge whether or not we're living our ideals, right? Walking the walk and not just talking the talk. I think that's really always a helpful one. But one that's related to that I've been forming over my career that certainly the fellowship deeply informed, including my readings of Dr. Schweitzer's life and the readings of others who shaped all of us, I think, is this idea of the principle of moving from injury to agency to justice. So, I talked about the harms. Moving upstream is about reducing harms and injuries, and then addressing the conditions that put people in harm's way. Well, as we know, there's so many folks, and ourselves included. There's moral injuries, there's hardships that we all experience. There's sometimes physical, emotional kind of harms that we all kind of go through. We can relate to with people. One of the things that makes the experience of injury or of harm, however people define it, right, most troubling is the loss of power. It's the loss of agency. So it's bad enough to feel hurt, to be hurt, to suffer. It's another thing to feel helpless in the face of that. And I think that's, for me, been a principle that continues to animate me, which is how do we take what is a universal experience that everybody can relate to, which is harm? How do we take the disproportionate burden that some communities are, by design, forced to experience in terms of that degree of harm? And how do we help more people make sure that we are able to transform that experience of harm and injury that we can all relate to at some point in our lives or in different ways to be able to regain agency? And then ultimately, how do we move from injury to agency to justice? Because it turns out the only way that I found to be able to move from injury to agency is together. In injury and harm, we are often isolated, but to be able to, the antidote to that injury, to that harm is coming together through shared agency. And it turns out that shared agency also allows us to work in fellowship to be able to address the things that are putting us all in harm's way.
Let's dig into this concept a little bit more. Let me also first pause and say it's like stupidly 40 minutes into this conversation and we're almost out of time. So, and where I feel like we're just getting started. Suffice to say that if you all are on the line and have questions, think about those questions. I think you can put it into the chat now. I'm not really sure. You can try at some point that will be available to you. And it'd be good to be able to draw from the chat box for some questions, which we'll get to here in just a few minutes. Um, so that being said, my head is spinning a little bit, mainly based on some of these conversations some that I've been a part of recently. I mentioned the conversation with Dr. Faro last week. I was in Dallas a few weeks prior. Actually, Dr. Manchanda, you were there as well. Daniel Dawes was speaking, and really just an incredible scholar, but often talks about political determinants of health. Dr. Faro was talking about the moral determinants of health. Um, both Rishi, Jess, you have both spoken before about social determinants of health, health harming legal needs, and a whole host of other items. And so all of these things are in relationship with one another. And the quote that Dr. Farr and I were talking about last week that he lifted up is a quote that many of you already know, which comes from Paul Farmer, said, "The idea that some lives matter less is the root of all that's wrong with the world." And so I am mindful of the fact that you can look at the years after our names, FFL 07, FFL 97, FFL 00. For the non-Schweitzer folks on the line, we are all fellows that have done our projects 20 plus years ago now, perhaps more well positioned to be able to speak about structures and systems and policies, and perhaps more able to push in certain areas. But what do you say for the participants on this call, many of whom are likely earlier in their careers in public health or in the arts or in the sciences or in language or in law, but all of whom have this bent to be able to serve their community and know that the world we live in is dynamic and there are various political and moral and economic forces swirling about. Um, how do you make a difference if you feel like you're not in a position or empowered to do that?
You know, I have to come back to I decided to make my life my argument because there when everything seems to be sort of the sky is falling and I know with my own kids now it's so crazy. I was pregnant with my eldest when I was a fellow and becoming a fellow and so I have these adults out there now trying to figure out how to move forward in a world that feels incredibly unfair, incredibly weighted against people who have needs that are not being met, and over again, that decision of what's the next right thing to do, I tend to think about, okay, well, I have to start with myself. And for me, the next right thing to do is what are the things that I stand for? What are the things that I find most important about whether that's Schweitzer's message? And frankly, Lachlan Faro has been an incredible mentor to me. And I'm constantly thinking about like, what would Lachlan do? Or what would Dr. Schweitzer do? Or, all of these wonderful fellows and people that are still involved with the Albert Schweitzer Fellow are also people that I look to and I say like, what's the next right thing to do? And a lot of that then I have to apply to the next action because you can think all you want about what the next right thing to do is in the abstract, but it's when you actually decide, okay, well, I'm going to actually do this next right thing, even if that thing is hard. And it may not feel like a big, momentous, life shifting, let alone someone else's life shifting moment, but these next right decisions and making your life your argument, making the principles, the morals, the ethics that you feel are really, really important in the abstract, a part of that compass, that decision making that you do every day, even if it feels like small decisions. You don't have to be out there changing the world every single second in big, huge ways because you're doing it in small ways. If you do it in small ways all the time, I think it remains easier to continue to try to make those good decisions every single day. And so for me, sometimes I can feel very disconnected from the big decisions that need to be made in this world in order to make the world a better place for everyone. But all I can do really is continue to make the right moral, ethical, decisions based on these arguments that I make because my arguments are not enough. They have to follow with actions.
And Jess, it seems, given your participation in the fellowship in 1997 onwards, these small decisions, daily, weekly, monthly, yearly, compound. Compounding's hard. It's a
Yeah.
hard concept for humans to wrap our brains around, but they do compound over the years. To your point of getting to a point where, I don't think anyone wakes up and takes a big swing and, you know, changes the world for millions overnight. I do think these things compound over time. Rishi.
Yeah, I think the that quote from Paul Farmer's, quote about the idea that some lives matter less is the root of all things wrong in the world. I think is a has the lessons in it, right? Well, starting first, being able to walk through with our behaviors, to Jess, your point about, the Schweitzer quote of life's my argument, being able to make sure that we treat every colleague, every patient, every client, every community partner, especially those who don't have the trappings of privilege, especially those who are come from kind of backgrounds that we know in the social strata that exist in communities in the US and around the world are seen as less than, especially to kind of make sure that we see them as equal and we see each other as equal is the first part of it. I think just being able to, through behavior, and that means like, it's not just the behavior, it's the most important thing to do is like that behavior, it's not observed. There's this day and age, there's a lot of performative stuff. There's always been performative stuff, but right now performative actions are rewarded by algorithms. Being able to have our behaviors, right, where we treat each other as equals, those behaviors be kind of central to our work, I think is key, especially when people aren't looking.
Yeah.
That's the first part of it. I think the other part is being able to build broad solidarity. We are helping people move from injury to agency by helping folks, health professionals included, respond to a lot of the actions that are putting a lot of people in harm's way, especially federal actions these days that are absolutely creating more harm and suffering in communities. We're helping find a way to kind of move from moral injury to agency for a lot of health professionals by just building solidarity with each other and with the pro-democracy movement. These silos about, people who say, healthcare, stay in your lane, or this profession, stay in your lane, or that's not your job. Call it out as BS. Like when you know that there are things that are putting people in harm's way, you don't need a senior title or a position of kind of comfort or safety to be able to work on it, especially doing it together. It's important just to establish solidarity. And that's especially true if you're early in your journey and you don't feel like you have the ability, right, the perch to kind of say something. It's okay to actually admit two things. First, at different stages, especially now in the world that way it is right now, it's important to recognize that a lot of people are afraid, but fear is the precursor to courage. There is no courage without fear, right? And secondly, that when we feel like we can't take a risk, which is very valid, some people might feel like they can't take a risk, then look for somebody else that you can share it with. Look to somebody else, especially a senior or a mentor, that you can transfer it to. Look for ways to be able to work together with others so you can actually accept risk, whereas individually you feel like you can't. There's a lot of ways, in other words, I think, through building solidarity to be able to, and learning, solidarity is a muscle, right? We have to develop it each day. So through these behaviors where we treat everybody as equals, we could then start building solidarity, which is where we show up and we show up with each other. That collective action is not just the stuff of good relationships and the stuff of happiness, I think, in terms of all the science and all the experience that we all have. It's actually the stuff of being able to take the fear, the injury, the harm that we all bear witness to or experience at different days, especially when people's lives matter less, and starting and find an antidote to that. It's only together that we actually end up finding a way from fear to courage. And I think that's an important element of what I take from that quote from Paul Farmer.
Could I add one thing really quickly, which is that one of the things that I do in my work, and as someone who's in recovery myself, I wrote about substance use prevention mainly because I'm an alcoholic and I've been in recovery for 14 years as of day before yesterday, actually, or as of yesterday, actually, and the thing that's been really important to me is that I talk about the fact that I'm an alcoholic a lot, because as a woman of privilege, a white woman who's allowed to say that and have it not risk my career and things like that, I feel like it's my responsibility to talk about that stuff so until it's okay for other people where it might blow their life up or make them lose their job or lose their child. There are people in the world that don't have the ability to tell some of the things that I'm able to tell. And it's like this really small thing. And I'm not necessarily saying everyone has to be public about the secrets, the things that are really upsetting to them. But for me, I feel like a small thing I can do is make it okay to talk about mental health and to talk about substance use disorder, because it's not okay for everybody to talk about it. And that's not fair. And it's not, I'm just going to keep banging on about it until it becomes fair for more people it becomes okay for more people to talk about it.
Yep, and I think there's real courage in that, and allows, I think, that kind of um, it allows people to also see themselves and other people and their journeys. And so I think you're exactly right, Jess. But I know we've got 5 minutes left for questions. And so we've got a couple of questions. I think some folks on the call here have already put in advance of this call. So I think Mary Chaudhry, you had a question. You were a new fellow for life from Chicago in 26. And your question is, how did you build upon your fellowship experience and get more involved in public health after finishing your first project? So you can imagine that a lot of these fellows are finishing their first project in graduate school. How do you build on that? What does that look like for you? Either Jess, to you, or to Rishi.
Sorry, Jess, do you want to go?
No, go ahead.
I have an 18-year-old daughter and 11-year-old son right now, and one of the things that I think about a lot these days is, you show me your friends, I'll show you your future. I don't know who said that, but I actually feel like it's an important one that has some wisdom in it. So to a certain degree, And I say that actually in the most positive sense. It's not deterministic, but there's something really important in terms of like actual practice here, which is I've found that the friends that I kind of continue to gravitate towards at different stages of my life have kept me true to the things that I want to aspire to. And I say this in both the highest of moments and the lowest of moments of my life. The friends that you make and the friends that you intentionally kind of reach out to, the more you kind of give to those friends, the more they give back. And collectively, those friendships allowed me to stay grounded in and even more deeply connected to public health or connected to social justice kind of work. Show me your friends, and I'll show you your future path to be able to kind of ground yourself in the things that the questioner was just asking about public health and whatnot. That's what I did for myself. It turns out there were career paths. I'm happy to talk about the specific kind of routes that I took, but more importantly, I was surrounding myself with people that, or I was inserting myself into networks of people who already had friendships that I was trying to kind of befriend as well. And that's a really powerful way to stay connected to folks. It could be through a formal fellowship. It could be through the informal lowercase fellowship of just being able to stay connected to friends who keep you motivated, friends who are cooler than you that you want to emulate, friends who are like, I really, I love that person, friends who are like, do something you're like, oh, I would love to do that too. It's all of that stuff that creates a set of norms that continues to kind of call upon the better parts of ourselves. And I think that's what I did for public health, and other things that I've kept. All the good things in my life that I've done have happened because I've had connections to people who I admire and call friends.
I'd love to add that as someone who has had a few crises along the way, I'm married to someone who does incredible, health work, saving people's lives and helping resolve big ethical dilemmas in medicine. And, there are moments where I'm sort of feel like, what the heck am I doing? I had this Albert Schweitzer fellowship, and what am I'm not healing anyone. I'm not fixing the world. You have to remember that there are these incredible opportunities that are going to spring up for you in the most unlikely places. And I'm not just talking about in your career. The only reason I get to do this work that I love right now, which is essentially just teaching, is because of the Schweitzer stuff. And yet at the same time, if you were to look at my career path or look at my quote unquote title, there are moments where I let it get to me that I'm not out there doing the big, huge, flashy work of saving lives. And yet I'm hoping that I'm carrying through some of that work in the teaching and in the interpersonal work that I get to do. So don't feel bad if you get to a place in your career where you're like, oh, I'm not fulfilling the path of the Schweitzer Fellow. You can do it in so many different ways, and it doesn't have to be huge and flashy with lots of titles at the end of your after your name.
I couldn't agree more. I know that we are already short on time. For folks that there are many more questions that did come in pre and during. We will try to get to those afterward and send emails back to folks. We have time for a couple of last minute thoughts from you, Rishi, from you, Jess. Any last minute nuggets for folks or closing remarks, and then I've got a couple of wrap up comments that I need to make. Any closing remarks?
Jess, do you want to go? Do you want?
No, for me, just being a part of the fellowship is often the thing that has refilled my cup. So if you get to a place 10 years down the road where you're like, man, I'm not making the strides I was hoping I would make in righting the injustice in this world, just come back and do some work with past fellows and current fellows, because that has been the unifying thread for us. That, oh my gosh, I can't believe these projects that these kids are doing. They're amazing. And now I will feel like I want to go out and start this, taking my extra salad greens to people. These are the coming back and doing work with the fellowship really is a part of doing the work as well. And so please just continue to tap into this incredible wealth, not just of knowledge and of experience, but of inspiration, because that's really for me what it has been throughout my adult life.
Rishi.
When everybody who is at the early stages of the career invariably kind of progresses on and does even greater things than what you've done already, which is incredible. There are times when you'll enter into moments where you feel like you're wondering if your values are being compromised. You're wondering if you're pursuing the right path to be able to have the maximal impact. You're wondering if you're able to, if you're making the wrong trade-offs in terms of family, career, and community or whatnot. Um, all of those moments will come up. Those are moments of either, some questioning all the way to deep moral injury. When you have those questions, this is a community. This is an additional one community, right? Along with other networks that you have to kind of tap into. So this fellowship, I've got a chance to kind of reconnect with fellows in this fellowship, having been not transparently as connected to it after I finished the fellowship as I otherwise should have been. And when I reconnected, it dawned on me that there was this whole treasure trove of beautiful, wonderful, kind of rich people who helped me actually understand how to navigate some of these kind of critical questions. So at key points as you go through your career, my parting advice is stay connected to each other, but also stay connected to each other under this umbrella of this fellowship for life, because it'll be that resource for you when sometimes you're asking yourselves questions that you can't find answers to in your professional work life or in your other spheres. This fellowship is a beautiful blend of people who share similar values now, and will continue to kind of be that as you tap into it.
Well, I think we'll take a second here and talk about how you can continue to stay a little bit more involved if you are a new fellow for life. This conversation tonight is part of the Albert Schweitzer Fellowship's broader efforts to energize and deepen our impact and our network. And so, for those of you that are Schweitzer alums, we really invite you now to join the pilot of our new Albert Schweitzer Fellowship networking platform. The goal of this platform is to do actually what Rishi just mentioned, which is to help fellows stay connected, to share resources, collaborate across regions and disciplines, and support each other long after the fellowship year ends. The link, I think, Rachel Gold just actually put it into the website, into the chat box right now. So to access this platform, use the email address that you used to register for tonight's event. And when you log in, you can actually personalize your profile. You can explore the networking and resource sharing features. You can, of course, even share your feedback as you go into the platform. And really, your feedback would be welcome as we are trying to, again, deepen this ongoing fellowship years after you finish your experience with the program. And then finally, for the first time in almost a decade, the Albert Schweitzer Fellowship is hosting a national in-person Albert Schweitzer Fellowship Conference with the theme Our Moment Is Now. The gathering will be a time for celebration and peer learning and action. It will be November 5th through the 8th this year in Tulsa, Oklahoma. Registration opens later this month. I know, Rachel, there it is. There's the blurb right on cue. So you can stay tuned for details. Really exciting work. I'll tell you, I attended a national conference 20 years ago and heard maybe it was 15 years ago and heard Dr. Rushika Fernando Pulli at the time, who had just started Iora Health. And as you know, was really one of the leaders in thinking differently about how healthcare is delivered in this country. And I heard from him for the first time at that conference. And so I'm thrilled for that to be back. So please make sure you save the date for that. Lastly, we're grateful to our sponsor, Rishi's organization, HealthBegins, for their sponsorship of tonight's events. HealthBegins is a national mission-driven organization that works to improve health by addressing the social and economic conditions that shape well-being, such as housing, food access, income, and community conditions. I believe their link will be added to the chat right now. So please, of course, explore their website and feel free to connect with them. Rishi, thank you and your organization for your sponsorship of tonight's event. We've covered a lot tonight. We've talked about what it means to leave your silos, what it means to build relationships, how to just show up and do the thing, how to move from injury to agency to justice, and so much more. I hope that your cup is just a little bit more filled as you enter this evening. We want to be a good steward of your time. On behalf of the entire National Schweitzer Fellowship team, Dr. Manchanda, Jess, thank you for being here, and thank you for joining us tonight. Please stay in touch. Y'all have a good evening.